Thank you, everybody, for joining us today. We are excited to be releasing the results of our joint American College of Emergency Physicians and Morning Consult poll, looking at the some of the barriers that we're seeing right now facing emergency physicians and those on the front lines as they seek mental health treatment. We are joined today by Dr. Mark Rosenberg and Jennifer and Corey Feist, the brother and sister-in-law, the sister and brother-in-law of Dr. took her own life after battling on the front line. Hearing by Dr. and the Feist, and will be ample time for all questions. If you do have any questions, please feel free to submit them via the Q&A feature or using the chat box. For those of you on the phone, at the end, we'll be leaving time for you to verbally ask your questions. Dr. Rosenberg, I'll turn it over to you.
Well, thank you, and good afternoon to everyone. My name is Mark Rosenberg. I'm president of the American College of Emergency Physicians. And I want to go through a lot of data and information that's coming out of this poll and research study. But before we dive into the top line figures, I'd like to give some brief, important context about mental health challenges that have long persisted in emergency medicine. Our job's hard, even before the pandemic. Frequently, we see patients and we don't even know their name. We refer to them as patient in room 1, if we're lucky. We have a death and we move on. We frequently don't even get to know who we just pronounced. And we take care of patients instead of ourselves. We care about our patients. We are amazing physicians. But as a result, there's a higher rate of career burnout, post-traumatic stress syndrome than any other specialty. Upward of 65% of emergency physicians and emergency medicine residents report experiencing burnout during their careers, and that's according to the Annals of Emergency Medicine. Research indicates that the United States alone, about 6,000 emergency physicians contemplated suicide in 2018 alone, and nearly 400 attempted to take their life. But working in the front lines over the past 6 months, dealing with COVID, really increased the crisis. This was not business as usual. Despite the growing toll that serving on the front lines is having on emergency physicians, many emergency physicians feel they can't seek mental health treatment that they need. Stigma and fear of professional repercussions prevent our nation's healthcare workers from getting mental health that they desperately need. The numbers from the poll today that we're releasing today underscore what we've known on the ground and we've heard from our members. We're glad to have these numbers reinforce our advocacy efforts. But before we get into it, let me just go over the methodology. The poll was conducted between October 7th and October 13th, 2020, among a nation sample of 862 emergency physicians. The interviews were conducted online using American College of Emergency Physicians provided member list. Results of the full survey have a margin of error of plus or minus 3 percentage points. Next slide. What we found is, and I'm going to go through a lot of this data quickly because I really want to get a chance to have a conversation with our guests. But 87% of emergency physicians report that they're feeling more stress since COVID-19. 72% report experiencing more professional burnout. Now, each slide that we're looking at, underneath the slide, you have the question that was actually asked of our participants, and then you see the graph of exactly what was going on. So here I said 87% of emergency physicians report having more stress, and you can see on the left it says stress, 87%, and on the lower bar it says professional burnout. And this is the format that we will go through over the next several slides. Next slide. So 4 out of 5 emergency physicians are concerned about family, friends, and personal health as causes for stress and burnout. 3 out of 5 emergency physicians are concerned about job and financial security. Next slide. 45% of emergency physicians report they are not comfortable seeking mental health services as needed. Next slide. Male emergency physicians are slightly more uncomfortable seeking mental health treatment than female physicians. Those in rural communities report the highest intensity of feeling uncomfortable seeking treatment. 71% of emergency physicians rate their ability to access mental health treatment is good or excellent, but at the same time, they're afraid to seek the treatment. Next slide. When it comes to seeking mental health treatment, 73% of emergency physicians feel there is stigma in the workplace. 5% saying there's no stigma at all, but the majority feel that they are at risk for stigma and problems with their group and where they work. Next slide. Females, older physicians, and rural emergency physicians report the highest level of stigma in their workplace. 57% report they are concerned about their job if they seek mental health treatment. Older and rural emergency physicians are more concerned about their job if they were to seek mental health treatment. Next slide. 27% report they avoid seeking mental health treatment in fear of professional repercussions. Next slide. This avoidance is most highly reported in female and younger emergency physicians that are working and those working in rural communities. Job security, professional stigma, future job opportunities are why people are afraid to seek mental health treatment and the professional repercussions cited. So the poll puts the data behind, the poll results are the data behind what we've known for a long time. So today, I went through all those slides very quickly. It's important because I want to get to the next part here. I'm honored to be joined today by Jennifer and Corey Feist, the sister and brother-in-law of Dr. Lorna Breen, an emergency physician and ACEP member who tragically died by suicide in April after working at the then epicenter of the virus.
Hi, thank you for having us. My name is Jennifer Feist. My sister was Lorna, and these statistics are fascinating. I will open by saying that today is the 6-month anniversary of my sister's death. My sister died on April 26th, 2020, 6 months ago today. This pandemic, of course, it's shining a light on the courage and dedication of our frontline healthcare workers. But we all know, and these statistics confirm, that beneath the surface, these heroes are also suffering. As we've heard today, emergency physicians are struggling to manage their mental health. And of course, we know this is not new. My sister, Dr. Lorna Breen, treated patients with COVID-19 in New York until she got the virus herself. Lorna was always tough, always smart, very active, always wanted to be an emergency physician in Manhattan. And for the first 49 years of her life, 49 years and 6 months, she showed no signs of depression or anxiety. That changed after she got COVID and was an emergency room physician in Manhattan. In the time between when my sister got sick and her death, and by the way, that period of time was about 5 weeks. When she was sick, all she could think about was getting back to work. In fact, when she was home, she was too weak to mostly get out of bed, but she was on the phone the whole time, attending meetings virtually, trying to find PPE, checking on her colleagues, and checking on those who were also caregivers who were out sick. Corey and I kept telling her about the airplane analogy. Make sure you put the oxygen mask over your own mouth before you take care of others. But my sister was just too focused on saving as many people as she could. With patients overflowing in the hallways, not enough PPE at the time, and minimal supplies, minimal as compared to the number of sick and dying patients, my sister rose to meet the challenges of COVID-19. And we believe that this ultimately cost her her life. What we do know is that when she finally did seek mental health treatment, that stigma that we talked about with the statistics, the one that women are concerned about, she was so concerned about the stigma of seeking help, so concerned about how she would be perceived by her peers. That was her main focus, and we believe ultimately it was her downfall.
Like Lorna, there are thousands of healthcare heroes who are suffering in silence, as the statistics today bear out. In this pandemic, we have witnessed an incredible commitment of our frontline healthcare workers. And for that, all of those healthcare heroes deserve both the title of hero and our applause, but they also need to be treated first and foremost as the humans that they are. Given the scale of the suffering that we're seeing in our hospitals across the country, it is no surprise that many of our emergency room physicians feel like they've got to be superhuman at work. But we simply need to give them the reassurance as well as the support that they need to take care of themselves first and foremost before they take care of patients. As Jennifer and I have learned over the last 6 months, as we've delved deeper into this topic, there's a 200% chance increase in patient errors when healthcare providers are burnt out. So if our healthcare heroes in the emergency department aren't going to do it for themselves, they need to do it for their patients, who they were sworn to protect. And as we've discussed already, physicians across the country are reluctant to reach out for mental health help. And Jennifer and I strongly believe that this status quo must change. It must change starting today. The rate of suicide among physicians is twice that of the general population. It is the highest profession. Think about that for a moment. Twice the rate of the general population, the highest rate of suicide of any other profession is in our caregivers. That's unsustainable and it's unacceptable. Like Lorna, physicians and healthcare providers suffer from a critically high degree of burnout and stress. And they need to be able to admit that they're suffering. They need to come out of the shadows and support each other and themselves. About 5 months ago, Jennifer and I established the Dr. Lorna Breen Heroes Foundation to extend Lorna's reach to care for those colleagues that she cared so deeply about. We all need to do a better job taking care of this critical workforce. Our emergency physicians are our front line, and they deserve all of our respect, admiration, and being treated as humans in this process. We look forward to more conversations in just a few moments. Dr. Rosenberg.
Thank you, Corey and Jennifer. Thank you for all your hard work, your passion, and your willingness to let us into your lives a little bit. You know, Corey, you and I met on Zoom several days ago, and I thought a lot about our conversation and a lot about what we were going to talk about today. And after listening to both of you, Jennifer, your passion and what both of you are doing together, it reminds me of a quote that I used a lot lately. But right now it seems more appropriate than it ever did. And the quote goes like this: "We make a living by what we earn, but we make a life by what we give." Lorna gave it all, every day. She did it for her patients, she did it for the profession, and she never did it for herself. And she is one who represents us all. But more importantly, we all try to be like her. We try to give tirelessly, selflessly to our profession. And Jennifer, just like you said, the airplane analogy, we don't put on our oxygen mask first. When I told the story early on that we take care of our patients, but we don't even know their name. We know what room number they're in. We know what disease they have. But I went into medicine because I wanted to take care of people. And the profession of emergency medicine makes it that I'm not taking care of people, I'm taking care of bed 3. I never get to know them. I never get to sit down with them. Corey, you and I were talking a little bit about the pause and, you know, when somebody dies, to humanize them as a person. I must tell you, every time I attend the pause in my emergency department, I get so emotional I can't even talk about it because it hurts. It hurts to feel the human side of our job, and we avoid it. For those of you who are listening may not know what the pause is, and you, Corey, you and I talked about it, but it's when a patient passes and the whole team at the resuscitation stops and talks about that person and makes them a human, makes them their name, makes them a family member, a father, a husband, and makes it real. And as much as that hurts, I wish Lorna was here to ask her, does getting to know your patients as a person meet the goals and needs of what it is to be an emergency physician? Do we do ourselves a disservice by not making it personal? I don't know. I think so. You know, as emergency physicians, and as ACEP, we are touched by this. And there's two sides to this story. There's the personal side, the people, the stories. When you leave work, I want a beer with a colleague. I want a hug. I'm a crier. I want to cry. And then there's the action side, the side of advocacy and legislation and awareness. And I'd like to take a minute and tell you a little bit about what ACEP's doing and maybe open it up for us to have our discussion as we promised each other. But more importantly, we have to come up with solutions. We can't just sit back and tell the story and tell the data, tell the numbers, tell the poll. We need to take the action. So from one of the things I know we both agree on is we have to eliminate the barriers that prevent us from getting mental health treatment, as you both already said. ACEP is leading, I believe, in the House of Medicine to fight and reduce the stigma involved with mental health, as you so articulated. There is no reason that doctors on the front line have to worry about losing their professional opportunities for simple things like if they have marriage problems and they need to see a marriage counselor, or postpartum depression, or just the anxieties and frustrations common to life in general. We need to have the opportunity to share that and maybe get professional help without being afraid of what's going to happen. ACEP is working with policymakers and clinical leaders to help create new programs, and many of these you already articulated, but really to address the burnout and change the approach of physicians to with mental health care in this country. The Dr. Lorna Breen Healthcare Provider Protection is one of those key initiatives, as you had talked about. Coronavirus Healthcare Workers Wellness Act of 2020 that ACEP has been fighting for and pushing for. Sorry, 1 second here, guys. We're also working with the Joint Commission to support clinician health in the post-COVID pandemic period, and by removing barriers to mental health and care for clinicians and healthcare staff. We have a joint statement with 40 other medical organizations supporting clinician health in the post-COVID period. We have a wellness resource program for our 40,000 members, but it's not enough. We need to get rid of the stigma. We need to get rid of the barrier to allow physicians and other healthcare providers to seek the care that they absolutely need. But Corey and Jennifer, I really appreciate you being here. Lorna has changed the way we look at emergency medicine, the way we care for our patients, and it's only the beginning. Do you believe we're on the right track? Is this the approach that we need to do? You guys touched your heart with this more than most.
Thank you so much for having us. It's the beginning. It's the beginning. It's not the end. But the fact that we're having a conversation, I think, is very important. And there are a lot of conversations that I think started because of what happened to my sister.
When we decided to step into this limelight and shed a light on the stigma, it was an incredibly painful and challenging decision for us. But since we did, we've never looked back, and we have received so much support from physicians, nurses, other healthcare leaders and professionals, other associations, ACEP, the AMA, go down the list. We know that shining a light on this issue right now is the right thing to do. And we are so incredibly appreciative of the support that we have received from the federal legislature, as well as at the state level, where we're working to try to to evaluate and potentially change all 50 states' licensing laws. So this is the time that we need to make significant change on this issue. And as Jennifer said, this is just the beginning. This is going to take all of us working together to redefine what we want and what we expect to be, first and foremost, the culture in medicine, and how you and then from there, all the different rules around it. But it's really critical that we not make this one death a flash in the pan, if you will. This needs to be the start of an ongoing and continuing conversation. And from the moment that Lorna died and we decided to step into this light, it was never about one person. It was about all the healthcare workforce and the real hurt that they're seeing and feeling and experiencing. And we've heard from hundreds, if not thousands, of healthcare providers from across the country that we're on the right track. So we know we are from that perspective, but it's going to take all of us working together to get there.
I have a question for both of you, and maybe it's painful, maybe it's not, but I need to ask the question. And let me put it into a little bit of a story. At work, my hospital, there's people who show varying degrees of stress or sadness, or something's just not right. And more so now post-COVID. Knowing Lorna's story, what do you recommend my colleagues, me, all my friends and family in the emergency department to do if we see something like that? What do you think?
That's a great question. Something that we have said a million times is, what would have happened if somebody said to Lorna, "Hey, are you okay? You seem off." That's it. And so, my dad is an 82-year-old retired trauma surgeon. Talk about a tough guy. He is super tough. And obviously this has been difficult for my parents. And I say to my dad, who's retired, but I've said to my dad, it's okay to be sad. It's okay to be, sensitive about this. You don't have to just pretend nothing happened and move on with your life. And so I really do believe there's a lot that we need to change. We need to change awareness. We need to make it okay for people to get assistance. In a lot of states, the licensing questions are, in our opinion, invasive. But I also believe in the butterfly effect, and people can change the world just by acknowledging that each other is human. So I think that's where it starts. That's how it starts right now.
I would only add to that two things. One, this isn't about being tough. Lorna was the toughest of the tough that I've ever met. And so if you think your colleague is tough and going to be able to tough it out, he or she may not be able to. And which leads to the second point, which is don't wait. This happened to Lorna in days, not even really weeks or months. So if you're worried, act now. Tap that colleague on the shoulder and ask them how they're doing. And when they say, "I'm fine," tap them again and say, "How are you really doing?" And if they need help, keep the line of communication open. Almost every hospital in the country has an employee assistance program. Many hospitals and health systems have specific programs for physicians that are all confidential. But what we have learned is one of the most effective tools for physicians is just talking to each other about the issues, whether they're formally trained or not. Peer support networks are critical to addressing this solution. And so even if you don't think you have the skills, you do by virtue of the MD behind your name, and sit there and listen and wrap your arms around each other metaphorically, particularly right now, and just take care of each other. Give yourselves permission to talk and listen. It's critical now more than ever.
I know there's some questions out there. I have a lot more that I'd like to ask, but I want to thank you both for bringing this to our attention. This is critically important now more than ever. And it takes heroes like Lorna to really bring it to light. And it's those types of heroes that change the world. And she has done that. Thank you.
Thank you.
Maggie, let me turn it back to you.
Thank you so much, Dr. Rosenberg. I'm just going to remind all, if you have any questions, feel free to submit them using the Q&A feature at the bottom of your screen. You may also raise your hand if you're on Zoom, and I will go ahead and call on you. First question, Jennifer, you mentioned a little bit about licensing. Could you all talk a little bit about the barriers that certain licensing laws present?
You want me to take that? Yeah, so it's interesting. Thanks for that question. What we have learned is that about 2 or 3 years ago, the American Psychiatric Association Journal of Law conducted an analysis of state medical licensing questions and rated them, gave them a grade rating based on how specific they were asking questions along the lines of past mental health treatment, and went so far as to identify certain states as even violating the Americans with Disabilities Act. And so what I would share with you all is that in early May, the Joint Commission, which accredits all hospitals and healthcare systems across the country, issued a statement. Now, it wasn't on licensure, but it applies directly to this. What it was about credentialing questions that are asked at hospitals and health systems. But it said to limit those questions only to current mental health challenges, if you will, that would impact patient care. And so it was a current question, and it was relevant to whether or not you could carry out your duties, like any other physical condition that one might have. And so those are the more appropriate questions to be asked. But there are many states, whether they even know it or not, that ask questions which reinforce this stigma. And even further than the state licensing laws, many hospitals or health systems ask those questions in privileging applications that physicians fill out. And then even further, we've learned that some insurance companies ask those questions when physicians enroll to be paid by insurance companies in what's called the credentialing process. So there are many, many layers of questions which all reinforce this stigma. The last thing I would say is that Lorna was convinced that her license would be acted on in New York by us finding an inpatient psych stay for her at the University of Virginia. She was not correct about that. New York actually has very favorable state licensing laws. I can't speak to the privileging or credentialing issues, but specific to the licensing law, it is a favorable state. So that leads me to believe that there's a large education opportunity here that we need to make sure that the healthcare workforce knows their local state laws, what the current state is. And the other thing that it tells me is that this stigma and this fear of professional action on your license or your credentialing or privileging is just pervasive throughout the industry. And I think the data that we saw a little earlier really underscores that feeling.
Great. Thank you so much. I'd like to turn it over to Dr. Anderson. I think he has a question or a comment.
Thank you very much, Maggie. My name's Steve Anderson. I'm the immediate past chairman of the board of the American College of Emergency Physicians. And Jennifer and Corey, my love goes out to you as someone who has also lost a close member. And I hope that you can feel that love and it helps to heal a little hole in your heart that I know will never completely heal. But I wanted to point out that, obviously in emergency medicine, every single day we deal with pain, anxiety, substance use disorder, and mental health crisis in the patients we see. And as you say, we tend to ignore it in ourselves. And the patients we see are disproportionately represented by diversity. They could certainly benefit from public health measures, and they're really the nucleus of the social determinants of health questions that we approach. And a lot of our focus is on them. And my colleagues really are heroes every single day. But for 35 years in practice, I've seen past hospital administrators, I've seen communities, I've even seen colleagues of mine who just wanted to hide these patients off in another part of the hospital, in another room, go and move on, pretend to hide them, and that they really didn't exist or they were somebody else's problems. And I'm really speaking to my ACEP colleagues who are listening right now, because yesterday, the Council for the American College of Emergency Physicians approved a brand new college-wide award to be given for innovators in the care of behavioral health and substance use disorders in emergency medicine. And this is an opportunity to celebrate those heroes who really have tried to make a difference in our specialty. And I just want to say you can either nominate somebody that you think deserves that award, or what I'd really like to call on my colleagues to do is to challenge you to become one of those heroes and try to win that award yourself. I just leave you with the fact that I lecture on this all over the country. And one of my closing statements is that isolation is the enemy of mental health, and involvement is one of the strategies to heal. So get involved on a personal level by recognizing a colleague that needs help, on a community level by finding something that can make a difference to all these people. And thank you very much for letting me talk about the award.
Thank you.
Thank you.
Thanks, Steve. As we're talking, I was thinking of a story, and I believe I told you this when we were originally talking, Corey, but I wanted to share it with Jennifer in particular, about one of the biggest problems I see with emergency physicians. And it's a story about a mom who has a family in Paterson, New Jersey. She has 3 girls that she's raised, working 2 or 3 jobs, and she has a niece who now lives with her. She was able to send all 4 of them away to college. And while they were gone, she had the attic of her house redone into like a dormitory so they all can come back for Thanksgiving. And here it is, Thanksgiving time, and the whole family's there together. And the father goes to take out the trash or garbage, depending on where you're from, what you call it. And he noticed some smoke coming from the attic. By the time he gets there, it's in total blaze. And the 4 girls were up there. And he couldn't get in. His wife tried to get in the room, and she became overcome by the smoke. And I forgot to tell the most important part. The mom, who was working 2 jobs, was already out to work that morning. So before I knew it, we had 3 burn victims, and the niece jumped out the window and was a trauma, as well as multiple burns and smoke inhalation. We were able to put together 4 resuscitation teams. And each team had 3 very bad outcomes and 1 that ended up going for hyperbarics. Here's the story. All 4 teams went back to work. They never mourned. They never talked about their experience. They didn't even know the patients' names. I stayed, and I was the one who was breaking the news to Mom, to tell her that her family has just fallen apart. You want to know something that's interesting in this story? Is I'm the one who healed. I'm the one who felt the pain. The rest of my team went back to work, and many of them struggled that night and subsequent nights because they just couldn't bring it to conclusion. Or something. I'm not even sure. I'm not trying to diagnose it. What I'm saying is emergency physician's job is so hard, but I think we've been our own worst enemies. I don't think we allowed ourselves the opportunity to take care of people, to feel the loss, to get to know their name, to get to know their family. So I want to throw this to you as a question. With Lorna, do you know if she got to know her patients? I know she was phenomenal, but was she like most of the emergency physicians, or was she able to connect in a way that most of us don't?
Oh, wow. That's a very good question, and I don't I don't know how much she got to know her patients. I can tell you that um, we grew up in a house where, frankly, healthcare was extremely important. I mentioned my dad, my brother's a doctor, my mom's a nurse, um, and Lorna, of course, was a doctor, and our parents always taught us about it's so important to care for people regardless of their level of wealth. Or my dad always used to talk about he doesn't care if people have insurance because you didn't go into medicine to get the insurance payment. You went into medicine to help people. I know that my sister had a deep level of concern for all of her patients. I don't know how much she got to know them. There were many over the years that she would talk about. There was a young woman who died years ago that Lorna was always really upset about. And she told me about a lot of the people that were suffering towards the end of her own life. And it was hard. It was really hard for her. And I do believe that after being sick herself, the combination was just didn't work. I think that she just could no longer process the death. And so I think that was, that plus that she was convinced her career was over. It was too much.
We do have one question from the Q&A. What can we do as a community? What might be the lowest hanging fruits for next steps for physician and health team associations so that we can make a difference now?
Right. I can start real with some real easy steps. Actually, our website, which is drlornabreen.org, has a take action site, and if folks take action, they will identify where they are geographically when they put their address in and who their members of Congress are. And it will send them an advocacy email or tweet or whatever, and it will automatically send your support to Congress to pass this legislation that Dr. Rosenberg has talked about. That is one very tangible thing that people can do. It doesn't cost a thing. Just click on the link at drlornabreen.org. That is one thing. The other is just to talk about these issues, and if you're working in a healthcare organization right now, to make sure that those who are in charge of the resources recognize that they need to continue to provide resources to support you. And then for physicians and other healthcare providers, I would say recognize that you hold a key role in helping to change the culture and taking care of each other. And that doesn't cost any money. That's just simply what we were talking about earlier. That's checking in on each other. That's giving yourselves permission to take a break when you need one, giving your colleague a permission to take a break when she or he needs one or is perceived to. And I know that that's easier said than done, but it doesn't literally cost any money to do. It is something that you can start doing today. Jennifer talks about the butterfly effect, and that's what she's talking about when she says that. It's just changing attitudes right now, talking about these issues. When we started to talk about this issue, what we learned is that when the unspeakable happens to you and you speak of it, it's amazing what weight it lifts off others. So speaking to each other about this stigma, speaking to each other about just your needs is going to be an incredible weight off of everyone's shoulders, so we don't have to hide in the shadows anymore. So between that and going on our website and sending a letter, an email automatically to a member of Congress saying you support this legislation that's before them, those are some real tangible things that can be done right now.
And I just want to add one thing. Corey and I did a roundtable last week at the University of Virginia, and our very good friend, who is also the chair of orthopedics at UVA and the president of the physician group, spoke. And what I would say is lead by example. We got this guy, again, he is a good friend, but we got this guy who's kind of the, he's the quarterback of the football team, so to speak. And he got on there and he spoke about the importance of mental health and the importance of supporting colleagues. If we could all lead by example with our own actions, those at the top and those at the bottom, I do believe that the culture will and can and will change.
Following up on that, we have a question from one of our members. Dr. Levin asks, what can the ACEP wellness section offer in terms of real help for our colleagues?
I'm going to ask Corey and Jennifer to jump in as well. And many of our physicians who have had depression and burnout have come up with ways that help them deal with it. Maybe it's changing their approach to emergency medicine. Maybe it's getting into palliative care as an emergency medicine subspecialty and treating patients differently. Maybe it's learning how to do mindfulness or wake up early and get some exercise in before your day starts. But those who have had depression and struggles, who have succeeded to this point, have come up with formulas that work for them. And having lectured at the wellness section at their booth every year, it is amazing the stories that you hear when you talk to survivors. And I think that they all learn from each other. Corey or Jennifer said peer-to-peer is frequently the strongest way to deal with things. We don't need psychiatrists, we need each other. So the first thing is the strength of our wellness committee, the resources that it has. And I think if we reach out to each other a little bit more, and colleagues like Corey and Jennifer, I think we'll make our section stronger. One last pet peeve I have is wellness isn't just for those who are healthy. Wellness is for those who have illness or injury. They too can be well, mentally and spiritually, even if they have physical impairments or otherwise. So that's my comments about this, but Corey and Jennifer, any comments you have, I appreciate.
So I'm not as familiar with the work of that committee, but what I would say as a general statement is, while I think it is critically important that we give our physicians and our other healthcare providers the tools to navigate this, we've used the canary in the coal mine analogy, and I'm going to extend that for a minute. We can only try to make our canaries as strong as possible. We have to redesign the coal mine here. And so the focus and effort that we're taking as a foundation is to look upstream to the causes, the root causes, if you will, of the problems, to try to redesign the processes, to redesign it to be a better, more holistic place, a more kinder, gentler place, if you will, not just culturally, but also just from process perspective. So I think looking at the totality of it, not just trying to make stronger physicians from mindfulness and wellness perspective, I think that's key. You know, Lorna's last academic publication was a year ago, November, and it was about meditation, mindfulness, burnout, those kind of things. So she was well aware of those things. But in a crisis, they did not come to her rescue, if you will. And so I think it's a twofold approach that we're advocating for.
Great.
I have another question here. It says there are a number of practice inefficiencies contributing to physician stress. So, how is ACEP coordinating with other specialty and healthcare organizations to find systematic solutions to physicians' work related trauma? How do we as an organization make it about a group or healthcare system, at least, or as much as an individual's responsibility as well?
Let me um, address the fringes of that just a little bit. I heard a statistic this morning in Incubate ED, which is a place where innovations come together, and you can get that online, part of ACEP 20. And there was one site that is an add on to the electronic medical record so that physicians don't have the stress of 4,000 clicks per shift. So instead of seeing patients, you're doing 4,000 clicks of a mouse and typing on a shift. And I believe that there can be innovations and different things that help make our job easier by identifying the key aspects of what weighs us down. In council, there was questions about what type of metrics are important and should we be held accountable for certain quality metrics, but more importantly, time to certain things metrics and all those pressures that are added onto a physician when we train to take care of people and we're being judged on other metrics. So I don't have easy answers, but I do believe if we think positively, we're going to come up with innovative solutions that actually make the workplace better. Another one is Joint Commission now allows emergency physicians to eat and drink beverages on their shift, and rather than to starve or become dehydrated or have a kidney stone because they're not hydrating enough. But Corey and Jennifer, any thoughts or comments?
No, I think you covered it.
Great. I have a question here for Corey and Jennifer. Are you all hearing anything from state policymakers who seem receptive to your efforts on changing state licensure questions?
Very, very much so. We have a consortium of organizations that we've been working with at the national, across the states at a national level, and we have been, I think, we've been overwhelmed with a positive response. And I think some of that response is a little bit of surprise in certain states as to the fact that these laws even were on the books. And so I think there has been great receptivity to change, and which is why we're on this roll, if you will, to look across all 50 states and come up with model legislation that can be used. We feel like right now more than ever we have a window to execute on it, if you will, and we've got to do it now. But yes, there is been much more receptivity to it, and from what we understand as compared to the past. And we weren't involved in it until the last 5 or 6 months, but the groups that we've been working with have been working these issues for a while, and now feel like they've gotten it over the hump. And part of that is Lorna's story and the advocacy that we're bringing, but part of it is just the drumbeat across the healthcare community right now as to the connection between the burnout and the stigma associated with licensure questions. So, thanks for the question.
Great. Well, that wraps up the questions that we have. So I'm going to go ahead and turn it over to you all for any final thoughts or comments.
Let me start, and repeating what I had said earlier in the quote by Winston Churchill. And we make a living by what we get, by what we earn. We make a life by what we give. Lorna gave it all, and she is the hero who is going to change emergency medicine and how we think about suicide and burnout and everything else related to our work environment. So thank you. Thank you for being here and bringing this to our attention.
Thank you so much for having us. I will add, it's funny, I'm not much on, previously, I was not much on any medical organizations as a lawyer, not somebody in healthcare, but I always knew about ACEP. Lorna loved ACEP. She was a member for many years. And I used to hear about so many of her friends from med school and residency who she would see and catch up with at ACEP. So thank you for continuing this conversation. And, I will say that I really 6 months later don't even understand what happened. But the one thing that I do understand is we're going to make it count. And we're not going to stop this effort. We're going to keep going until we're out of work, basically, till we've got nothing left to talk about.
That's right. And we would invite everyone to join us in that effort. You can learn more about what we're doing, but I would also put an offer out for those of you who would like us to come and talk to your healthcare organizations and others. ACEP and that ACEP community is so critically important to us. We really feel like we're extending Lorna's work at caring for you all and caring for her colleagues. And so please don't hesitate to reach out to us. We'll make ourselves available. This is critically important. And maybe to say it a little different way, even though we've already touched 65 million folks with 70 publications, four of which we drafted ourselves, and in numerous television appearances, we're just getting started, folks. So please join us and we'll do this together. Thank you so much.
Thank you so much, Corey and Jennifer and Dr. Rosenberg for participating today. And thank you everybody who joined and asked questions. If you would like to see more about the poll, you can visit emergencyphysicians.org/mental health poll. If you have any questions for our panelists or about the poll, you can email pr@acep.org. Thank you.
Maggie, there's a couple comments on the chat that are probably worth stating. One is ACEP State Ledge Committee is dealing with those licensing issues, and I'm glad that was brought to our attention. So we're also trying to work with federal law to supersede the state law. And there's another comment that we need to promote peer-to-peer counseling and a network on ACEP's site. Peer-to-peer counseling, as Corey and Jennifer had said, is a key where we can help heal ourselves and bring our spirit to each other. Those virtual hugs, that beer after a shift, and just a shoulder to cry on. Thanks, guys.